Good morning. This video is being posted on YouTube, and it's offered so that members of the committee can view it, as well as possibly putting it into the record on the appropriate page. Thank you to the members of the committee, Leader Crapo, and of course Chairman Wyden. We agree that the system is broken and fragmented, and unless Congress removes the government plans totally from the system and then puts everything into one plan, there'll be holes, especially with undocumented workers no longer covered. Also, the other flaws are the fact that the Silver Plan and the other Affordable Care Act is just too expensive, both the co-payments and the premiums. So a lot of people, especially with no mandate, aren't going there, which is a shame. And the reason that's a problem is because hospitals will still transfer costs to other people, will still have fees higher so they can get more from the medical charities account rather than in doing accurate pricing. So there are several solutions I'm offering. One is changing the state contributions to Medicaid, eliminating them for seniors, federalizing them as Part E of Medicare. Medicare for All is actually Medicaid for All, and for seniors, it should be funded by CMMS or managed by CMMS, and that is the camel's nose for long-term healthcare reform. The option B for doing this is a public option, it was rejected in the Affordable Care Act. That was regrettable. The option would be in exchange for ending pre-existing condition reform. So if you were denied pre-existing insurance for a pre-existing condition, you'd simply be signed up automatically for the public option, which should be heavily subsidized, if not totally subsidized, depending upon your income. It would also take over Medicaid, to the extent anyway that service providers or the unemployment insurance system don't provide health insurance as part of the payments, and that health insurance would be in the program of the employees. So the state would pay UI, would take UI recipients and put them in the state employees program. Likewise, if anybody's offering training, the training provider would fund their health insurance. So that is the other option. And that includes ESL, by the way. So if ESL recipients, regardless of immigration status, take courses, and they should, we want them to. English is the unofficial official language of the United States. Then they should be paid to actually take the course at the minimum wage, and the minimum wage should be higher. And again, it solves the problem of uncompensated care. Eventually, the public option would be one of those pay it now, pay it later things, because the insurance companies will certainly put more people into the public option, so would employers. And when that happens, eventually everybody will be in the public option that's sick. And eventually it means the public option will become healthcare reform called Medicare for All, or Medicaid for All. It's a distinction without a difference. If it's combined with Medicare Part E. We have a tax reform plan, which is on a separate video. I will attach it, or I will link to it so that members can see it. as an attachment so it doesn't count against my minutes. And I will wrap it up by saying thank you very much. I hope this is published. I'm doing this more stream of conscious so that it seems like I'm actually delivering the remarks rather than heavily editing them. So again, thank you very much.